first of all, hopefully we've got Andy with us, Andy Cuthbertson. So if we pass over to you, Andy, and you're going to talk a little bit about the Suffolk Advice and Support Service.
That's brilliant. Thank you, Kate. Thank you for that introduction. Welcome, everyone. I'm really pleased so many people have dialed into this meeting. It's a really kind of key moment for us in terms of giving the warm handover a bit of a boost and really kind of helping it align with the Suffolk Advice and Support Service. So I'm really pleased that so many of you have been able to join us. Just for those who aren't aware, I'm Andy Cuthbertson. I'm Community and BCSE lead within the Public Health team, as Kate said, and we're based within, we're specifically the Locality and Partnerships team within Public Health. And although we're within that particular department, we very much see ourselves working across not just Suffolk County Council, but across the Suffolk system, really supporting and working with partners to ultimately develop services and enable people to better connect up systems and partnerships and keep people well in their communities, really. So we cover a whole range of activities and services. And as of January, the warm handover and Suffolk Infolink came over into the Locality Partnerships team. And we were very pleased actually to welcome that team into our team because, or that service, I should say, into our team, because we feel it very much fits with what we are trying to do and the way we try to work, which is very much about enabling people to access services, not just from the public sector, but from across the range of partners. Many of you who obviously are here today. So it was a welcome addition to the services that we provide as a team. Clearly this morning it's going to be about a bit of a reminder of the warm handover. Many of you have been partners of the warm handover for many years and have been using it very well over that time. But it's also a time to refamiliarise yourself if you haven't looked at it for a while. But also anyone who's perhaps new to it, either new to your individual organisation, or new to the warm handover and Suffolk Information Partnership, to really get a grip with the way the system works. So as I said, I'm really pleased so many have joined us. So really, I was really asked to give a little bit of background about why we are kind of why we're doing this, why we're giving this having this session this morning, the way it links with the Suffolk Advice and Support Service, but also to highlight a development that we've tried to bring in this year as part of this expansion. So many of you would have been aware of the Home But Not Alone service that developed during COVID, which tried to connect vulnerable individuals up with services and support that existed within their community. As we went into lockdown, it was clear that many VCSE organisations were adapting and changing the way they supported individuals, and it was clear that we as a public sector had to try and enable people to access that support as quickly and easily as possible. So the Home But Not Alone service was developed and primarily supported individuals with access to things like food, medical advice, medical support, or access to the medication, and befriending type support, and ultimately signposting through to organisations who can help. As time went on, the service became adapted and changed, and clearly people who were accessing Home But Not Alone, the nature of the calls changed in that people came forward with more complex and challenging needs that required wider BCSE support. Some from many from the likes of from yourselves who are here today, really. And so the Suffolk Advice and Support Service is a legacy from Home But Not Alone. The service was launched last week on the 1st of October, and it was really aimed at what was being classified as the newly vulnerable cohort of individuals who were, as a result of COVID, were finding themselves with a particular vulnerability, primarily linked to the economic impact of COVID. There was an identified cohort of people that were perhaps had never had to engage with both public sector services or the kind of services that yourselves provide, and we needed to find a way that we could enable them to access those services as seamlessly as possible, but also individuals may need the support to access more than one service at a time. So the warm handover was highlighted as a key part of the Suffolk Advice and Support Service, and so I was really pleased that it was brought into the fold and gave it an opportunity to really showcase what the warm handover can ultimately achieve. As I said, the service was launched last week. There is a telephone number that is available. If you type Suffolk Advice and Support Service into Google, it comes up. It's a top link. It's a web page on Suffolk County Council's website. We're hosting that that web page, but it's very much it's not primarily a Suffolk County Council or senior Suffolk County Council service. It's just that's where the information is held. It's born out of the Collaborative Communities Board, which is a system-wide partnership of organisations, and we're just the host for that web page. The way the system works is the people will contact that telephone line, and a collection of organisations, many of you who are on this call, as I've said, such as the CABs, ACT and IHAG, will receive those contacts, primarily because people's needs will be linked to financial hardship in some way, shape or form. They will triage the individual's needs, and then using the warm handover, if additional needs are identified, we'll use the warm handover to make the direct referrals to other partners in the system. I should also add that there are, within this the Suffolk Advice and Support Service, there are 5 elements of the service. There is this what's being classified as the single point of access, which, as I said, is the telephone line and the support that's being provided by those 3 partners. But it also has direct access to the local welfare assistance scheme, which has been relaunched as a result of COVID, which provides people with access to primarily things like household furniture, white goods, but also supermarket vouchers and that kind of support to people who are in crisis and need access to that system. Individuals themselves can't directly apply for the assistance. However, they can be signposted through gateway partner organisations, and there is a list on the website of those gateway partner organisations. And equally, if you would like to become, and you're not a gateway partner organisation, you can apply to become so. And we are trying to welcome as many organisations as possible to act in that way. There is also information about the role of food banks and where they fit within the advice and support service. We are supporting food banks with additional support at this time, and we've given them access to not just kind of food directly, but also non-food items as well to meet individuals' needs. And so clearly the food banks are going to be a crucial part of the support to vulnerable individuals. And then lastly, the 2 other parts of the service. One is obviously the warm handover, which we're talking about today, but we've also brought into the fold the Suffolk Info Link, which is, to my mind, runs very much hand in hand with the warm handover as a crucial a tool to enable people to access support and services that exist within their community. We've placed that within this particular part of the service because it's again an additional tool which we can signpost individuals to directly.
Andy.
Hello.
Hi. We've just got a question from Malika. I don't know if she wants to ask that.
Yeah, it's just quick. My understanding was that the LWA ended at the end of October. So this is now, does it just continue as it stands, or have I got that wrong?
So there's limited money with it. The money has come from DEFRA. There is a limited pot of funding within there. We need to kind of have that access. So it is still open at the moment. It's still part of the service. But there is a finite amount of money. There is, I can't guarantee it will be continued. It's not sitting within my particular jurisdiction. However, I know that there are conversations about increasing the amount of money that will be within that pot as time goes on, because clearly we haven't felt the true impact of the kind of economic hardship at this time. So it's part of the service for that reason, really.
Thanks.
Okay. Lastly, all I really wanted to do was highlight a development that we've brought into the warm handover this time, and it all comes down to money, doesn't it? So we very early on we made the decision that we wouldn't be charging partners this year to become part of the warm handover. I know previously there was a financial contribution which we've taken off as part of the system. It certainly doesn't feel right to sort of charge people to kind of want to work in partnership. It doesn't seem the right approach, really. So we've taken the payment away from the system. But what we're bringing in as a pilot for the next 6 months is an incentive bonus, really, a payment process to partners to both use to make referrals and to receive referrals. It's aimed at only the VCSE organisations who are part of the system. It's not going to be paying statutory partners to use the warm handover, but it's designed really to incentivise organisations to use the warm handover. And really, to my mind, although we're aligning this with Suffolk Advice and Support Service, the warm handover has much wider reaching kind of benefits really to partners. And so the more we can incentivise users to use the warm handover, the stronger the partnership will be. So the way the payment will work is, if you are an organisation and you receive a referral and you identify additional needs for the client who you are supporting, if you use the warm handover and make a referral to other partners, you will receive a payment. But also the organisations who you refer to will also receive a payment for picking up that referral. Before everyone gets too carried away, it's not huge amounts of money that we're talking about here. We are only it's a notional cost of £10 per transaction. So if you make a referral, you will receive £10, and if you pick one up, you will receive £10. We're doing that really as a pilot to really prove that as a system you can create a mechanism that supports VCSE organisations who are supporting those who are the most vulnerable. Very often, and a criticism that I've had, although I'm a big advocate of social prescribing as a service, a criticism I think which is a fair criticism is often that actually all the need is pushed down to VCSE organisations who aren't actually in receipt of the finances to support those individuals. So really what we're trying to do is use the warm handover and prove that it can be used as a mechanism to support that idea that the organisations who are providing the service can actually be paid for to pick up those referrals. As I said, it's a pilot for the first 6 months. We're going to see how it goes and monitor it. It may work. It may not. I'm hoping it will, and I hope it will be welcomed by members of the Warm Handover Partnership. Clearly, processing lots of individual £10 payments is rather complex and challenging. So we are going to be doing it quarterly, bulking those payments up to into one transaction rather than individual payments, to make the process more efficient. And Kate and the team will be reviewing the system as it goes along, and being in contact with each individual partner to confirm the amounts that each quarter period will be made. So hopefully that's welcomed by everyone. By all means, if anyone's got any particular questions now, or if there's questions at the end, then I'm happy to try and help and support, as I'm sure Kate and others will be, in terms of trying to answer them.
Okay, thanks very much, Andy. The one question that came up from Joy was, does it apply to Suffolk County Council and statutory organisations? And it doesn't. So that's it is for voluntary sector organisations only.
It is absolutely, and it is just an incentive payment in that respect to try and encourage more people to use it.
Okay, and to get the data we'll be looking at the statistics from the warm handover platform to so that we can work out who's made what referrals. So you won't need to keep your own records for that. Then it should all be done, and we can let you know how many referrals have gone through the system. Thank you very much, Andy. If any of what Andy said you sort of think of any questions, then do put them in the sidebar and we can always pick those up afterwards. But really appreciate your time, Andy, for that and putting the new warm handover into context. We're sort of running a little bit behind time, so I'd like to sort of move on to the presentations, and we want to make this morning as interactive as possible, given the constraints of the technology. So we're going to ask the organisations here just to literally give us 2 minutes or no more than 2 minutes about your organisation, the services you provide, and also if anything's changed because of COVID, so services that you might have been running but no longer do, then just updating people on where you are with your services. And I'm going to take you in alphabetical order, but I'm going to start off with Suffolk Mind and Lee, if that's okay, because Lee's got to leave the meeting at 11, so I just didn't want to sort of miss out on you, Lee. So if you want to turn your cameras on, you're very welcome to, but don't feel any pressure to. But please remember to take your mute buttons off. So over to you, Lee.
Thank you, Kate. So Suffolk Mind, if I talk about the services that we have as open access, which we mean that anyone can access those, we have services. So we've got Suffolk Work Well, which is a service for anyone with mental health that is aiming to help people get work ready, gain employment or retain employment, and especially at the moment with everything that's going on. That service we've continued with all our services throughout lockdown, but we've just moved into platforms, Zoom, telephone, and we're just about to start going back face to face with some of our services as well. So Workwell is available mainly in the east of the county, and that's because of the funding that is available. We have our service called Waves, which is a service for those with the diagnosis or traits of borderline personality disorder, and that runs in Haverhill, Ipswich, Bury St Edmunds and Felixstowe, and that's a group setting. At the moment it's done via Zoom. It was done face to face. At the moment, we've got no plans to restart that going face to face, but we're slowly building up, and clients are actually enjoying it. Zoom, because it gives the flexibility, as we know with Suffolk, it's very rural and transport, etc. So we're taking a public transport. We're just about to start going back to our green care services, which is for those who it's a community allotment based project, and that runs in Haverhill, Ipswich, Bury and Hadley, and that is a allotment, like I said, allotment based project, and at the moment it's running fortnightly because we're having to put more things into place, as you can imagine, 2 meters, etc. We've got a brand new service which is starting in November. It's called Mums Matter, and it's for any mum that is in the perinatal time of so pregnant or child is up to age of 2 years 11 months, and they're experiencing depression, anxiety, overwhelming, low self-esteem, etc. And that is starting in November, and that's a 6-week course. At the moment we're piloting it for just Ipswich, but it will be rolled out in the new year to Woodbridge, Leiston, Felixstowe. So that's a Mums Matter pilot. And Suffolk Night Owls is a 7-day telephone support line. That is 7 a.m. to 1 p.m. No, 7 p.m. to 1 a.m. Sorry, and that's the telephone support line. All the services that I've mentioned so far are free, but we do have our counselling service, which is at the moment we've been awarded quite a lot of grants to be able to offer counselling free. But as you can imagine, we have gone through though a lot of those. Some of them, I mean, the fastest one that we had was 70s grants for 70s in lockdown, anyone over the age of 70, and that was taken up within 7 days. So we do have some counselling grants, but some clients are now paying for that session, those counselling sessions. I hope I've covered everything in 2 minutes.
Okay, thanks very much, Lee. I think just Nellika's put a question on which has been answered about charging when you mentioned, but perhaps when you've done your 2-minute pitch, if you could just check the chat. So if anyone has asked any questions about your service, you can then respond. That would be really helpful. And thanks very much indeed, Lee. There's going to be a lot to take in this morning, so hopefully if the recording is working okay, we should be able to share that, and then you can replay bits and pick up on all the details of the services. So if we now go on to Beth at Access Community Trust, please.
Thanks, morning. Okay, given the time, I think what I will do is just inform you of the new services that are now available from Access Community Trust, as opposed to talk about all of the different services. You can find those on our website anyway. So I'm Beth, I'm our Involvement and Inclusion Manager. My role is at the moment has been co-producing and facilitating a new service called the Waveney Lived Experience Advisory Forum. And that is a service which gives users of mental health services across Waveney and their supportive others a platform to really share their experiences and have those voices captured and then used to inform positive change. So we have really strong agreements in place with statutory services and voluntary organisations to receive that feedback and experience and then inform us as to what's being done with that. We're creating a panel of expert citizens, people who are experts by their own experience, who are receiving a package of training to then be able to represent the lived experience community in front of decision makers, as well as mental health information and guidance drop-ins for people who need support in knowing what services there are and how to access those services. So working closely with social prescribing teams as well. So that's in a nutshell, that service. And our other Waveney-based service that's just launched is a Routes to Work service, which is employability skills training and support for people to access employment based in Waveney. Suffolk-wide projects, our Pink Orange project, which some of you may be aware of, was over COVID, where we delivered multiple times to nearly 12,000 homes of children receiving free school meals. We delivered kits of cooking ingredients and recipe cards to support families to cook together and then eat nutritious food, and that was over the 7 weeks of the holidays. That project is now rolling out long term, so throughout all of the school holidays. So we've got half term coming up and then Christmas holidays will be still available all across Suffolk. All of the information will go out to every single school. And so people can just register online. It's completely free. You can head to our website, accessct.org, or our social media to find out more, but this will further information will be rolled out across the county over the coming weeks. And we're about to launch a new Suffolk-wide product, which is community circles, working specifically with young people around mentoring and raising aspirations. More details to follow. Whew. So I think
Thanks very much, Beth.
Whiz through that in time. Thank you.
Okay, fantastic. Thank you. Right, now Anglia Care Trust, and over to Chris.
Hello there. A bit confusing, isn't it? Because obviously we've had Access Community Trust and Anglia Care Trust. We're all getting a bit ACT'd out. But anyway, I'm Chris Goldsmith. I'm an operational manager for Anglia Care Trust. We're a Suffolk-based charity, been running for about 50 years. In terms of services, primarily our services cover all of Suffolk. We also touch North Essex and parts of South Norfolk. And all our services are free at point of access, so there's no charge for any of them. There are some limitations in terms of eligibility, but that's on a per service basis. And what do? We cover housing for a range of people, refugees, ex-offenders, and various other people. We do domestic abuse support, we do drug and alcohol support, we do independent visiting, we do employment support, we do send mediation. We obviously do money advice as part of the SAS service, which brings us to this forum. And we provide appropriate adult services in both Suffolk and Norfolk. So that's kind of us in a nutshell, really.
Okay, thanks very much, Chris. Right, now we're going to have a joint presentation from Citizens Advice, and those of you that have been part of the Warm Handover scheme for a while will know that we've had 3 Citizens Advice Bureaus as partners, and you'll be delighted to know that we've now signed up all 8. So we're going to start off with a video that's been produced by the National Citizens Advice, just to give you a flavour of services, and then Janet John is going to talk for a few minutes just on the more local detail.
Okay, can you see the screen there?
When I opened the letter, I just went into a panic.
Oh, what's going through my head is, can this be sorted? Can this be sorted?
I couldn't really sign on and give the declaration that I'm fit for work because I wasn't.
I was feeling really overwhelmed and as though we were going to lose everything the way out.
One week, my money didn't go in, so I phoned the departments up and they said, well, you've now been swapped over to Universal Credit. I said, but I've got no money. And they said, well, you have to wait 5 weeks now. Some weeks, it's not £30 of shopping, it's 10 tins of tomatoes and a loaf of bread and have tomatoes on toast.
My marriage broke up and everything just started going downhill. I can't read and write. I'm sinking with debt. I found myself homeless with my 11-year-old son. Around this area, there's such a demand for housing. They do not go for unwaged.
The amount of pain that I'm in is severe. I was required to go and have a health assessment. After that, they decided that I was no longer eligible to employment support allowance.
You know, it's not a big amount of money, but I do feel that companies shouldn't be allowed to treat customers this way.
I was needing to take out more credit cards and payday loans to support myself and my son. I didn't know what to do, and somebody suggested go to Citizens Advice, they'll help you, and I'm glad I did.
After I've been to the doctors a few times, they mentioned that Citizens Advice could help me quite a lot. But it took me about 3 or 4 days going there before I actually went in.
So I phoned up and made an appointment. On the same day I went up, we filled in that many forms and she was giving me options.
Living in a rural area, to be able to phone up the Citizens Advice Consumer Helpline is great. You know, I don't have to make a big trip.
I got in touch with them online. Citizens Advice made a difference because I was able to give them all the information that for them to prepare the appeal papers.
I've had quite a complicated life over the last 3 years, and they've been absolutely amazing. They've got people that help with housing. I've been there, they've helped out with form filling.
The threat of that debt over me, like obviously it can affect you quite badly, constantly worrying. He made me feel very relaxed and encouraged and supported. We worked together to achieve a really fantastic solution.
This is it. This is your pay plan. Paying off your catalogue, paying off your credit card, paying off your overdraft.
The future's looking brighter with the help and support that they've given me. Now I can see the light at the end of the tunnel, and it's a good feeling.
You've been absolutely brilliant with me, and no doubt with thousands of others. Thank you very much.
Thank you to everyone at Citizens Advice. You do a fantastic job.
Thank you, Citizens Advice, for everything you've done for me.
Thank you very much. Big thank you. That's from me and my
Thank you to everyone at the Citizens Advice that took the time to save my life.
Okay, over to you, Janet.
Thank you. Sorry, I put on my video, not my microphone, so I'm just take my video off again now. Hopefully, okay. I think that video, and our apologies, we sort of took a slightly longer slot, but there are several of us. Identifies some of the main work that we do. We have a holistic approach to all clients, and this is where SIP comes in particularly helpful for us. To give you an example, we might have somebody who's just been diagnosed with an illness, say MS. I'm not sure the MS Society is on SIP, but this is my example. And they may have housing problems, they may have debt problems, they may have benefit problems. And we can deal with all of those, but they may want to be in touch with an organisation where people have a lived experience. So where SIP comes, one of the places SIP comes in for us, and it's just one of them, is that we are able to refer people to an appropriate support organisation or an organisation that can give them appropriate support. And we've, up in North East Suffolk, have been on SIP just about since the beginning. That was partly to do with some funding that we had, and the fact that it was obviously a very good and useful mechanism. In terms of LCAs themselves, because we're not allowed to call ourselves bureaus anymore, there are 8 in the county, as Kate has said. We are in every major town. We are in some of the smaller towns as well. Kate has asked me to give a telephone number for contacting us. We don't have, because we're 8 separate charities, we don't have a single telephone number to give you guys as other providers. However, in terms of clients, we have, and that's the SAS number, which was set up and, as you've heard, went live last week. So any client phoning the main SAS number get the option to, depending on where they live, press 1 for Baber, 2 for East Suffolk, and so on and so forth, and they will be connected to us, and we will take that client on from that point. And it's possible that if one LCA's line is busy, it will be another LCA that picks up the call, and then we will refer the person on. I'm trying to remember the statistics, but I think we dealt with in over 20,000 people last year. Perhaps one of my colleagues can correct me on that one, or even tell me it's a bigger number. the other thing to bear in mind is that we are, when we talk about advice, all our advice is quality assured. It's not just the case of saying, well, yeah, you can go down the road and do this. We actually do give the advice, and we are, as I say, quality assured. And we're a bit like a rash in some senses because we're everywhere. Several of us are involved in social prescribing projects up in Waveney, one up in Lowestoft and the one in Ipswich have advice at their heart. So the first thing that the client sees when referred to us, when we're in the surgeries, is proper advice. Adequate, we look at the client's situation and we provide the advice, and we quite often see clients more than once. We quite often have them back into our own premises to do lengthy things like PIP forms. And talking of premises, we're all at different stages in terms of COVID. We all transformed very, very quickly. We helped 23,000 clients in Suffolk last year. Thank you. In terms of COVID, we all transformed very, very quickly to remote access. So either through our websites, through email, or through the telephone. In terms of going back into face-to-face, some of us are. Some of us, that's going to be quite limited. Some we up in Lowestoft have yet to go back to face-to-face. I think it would be fair to say that we are very cautious about face-to-face and maintaining social distancing. So it is probably the case that initially we won't be doing drop-ins anywhere. We will simply be doing appointments. I don't know if Nelika wants to come in and say what they're doing in Ipswich, which is, I think, probably a little bit, well, certainly more advanced than we are up in Waveney. And I think going forward, we will still have face-to-face services across the board. But I think the balance of our services between digital and face-to-face will be different when we come out of COVID altogether. I hope that helps.
Thank you. Just very quickly, Nelika, and then we'll move on.
So in Ipswich, we are in the main still offering remote advice support. We do, however, have the option of people coming and having a safe place to speak. So we've got a video room. It's a bit like the Big Brother diary room that people can use, and the advisor will be remote from them, but they're away from their home, which can be a very useful thing for some clients. We also have some limited face-to-face for people who really do need it, but it's not a drop-in service.
Okay, thanks both very much, and that's really helpful. There are some comments down the side, so just keep an eye on those. Have we got Teresa here, or anyone from the Disability Advice North East Suffolk organisation? Don't think we have. We've actually got two disability advice services on the warm handover. One is North East Suffolk and the other is East Suffolk. And the picture's a bit like the citizens' advice, that they only cover specific areas of the county. So if you are referring through, then please make sure that the client you're referring covers the catchment area of that organisation. I don't think we've got anyone from Healthwatch on either, have we? Okay, have we got Shelley from Home First? No. Okay, so over then to Alison at Home Start in Suffolk. And Eleanor, have you been able to get the video up for them?
Yes.
Okay, great. So so we'll watch the video, and then Alison, if you can say a few words, that would be brilliant. Thank you.
Yeah, fine.
my name's Eve and I have a husband called Sam and 2 young girls, Noella and Alba, and both girls have a diagnosis of autism. I love living in Suffolk, so I love the Suffolk countryside and it's very beautiful, but I don't have a lot of family and friends here, and certainly when I first moved here, Noella was in a very bad stage with her autism, and I was extremely isolated. Noella really struggled with understanding why her sister had been born, what her sister was, you know, and her sister Alba just cried and vomited constantly for 16 months. I remember a time when, a long period of time actually, when I would be downstairs with my newborn baby who was crying constantly, vomiting constantly, and I would be in a state of running upstairs to check on Noella, who would be in a traumatized meltdown state, physically hurting herself, smashing up the house, hurting other people, smashing anything that she can find, regularly poo smearing up the walls, eating her own feces, these kind of things. And I'd be dealing with that upstairs and then running downstairs to try and console my baby. My husband experienced all these things as well, but he was then going to work into an office every morning, and although he's working very hard and very stressed, he's also having lots of human interaction with adults, you know, whereas I didn't have that at all. As a parent and as a mother, it's not really socially acceptable to say, what have I done? Like, this is not what I asked for, this is not what I expected, this is not what I thought parenting was. So you have these children and then they are diagnosed with something that you've got no idea about. You know, I didn't know anything about autism until I had 2 autistic children, and it kind of robs you of your parenting experience. And living in, like, you know, now with the internet and Facebook and things like that, you can, it's not only that you know other people are having a better parenting experience than you can see it, you know, you see people being able to walk down the street with their children. I still can't walk down the street with my children. Homestart matched me to my volunteer Julie. On the days that Julie visited, I remember my husband saying that he felt a lot more comfortable leaving me in the morning to go to work, and he didn't need to, or didn't feel like he had to phone me 100 times a day, because he knew that for 3 hours in that day I had someone else there. If it wasn't for Homestart, the isolation that I was experiencing at that time would most likely have led to mental health issues, which would have had a huge impact on my children, my family. Homestart coming in and giving me Julie. Julie's like a lifelong friend now. I'm going to cry again. She's really special to me, and sometimes I feel like she's the only person that I have down here who really knows me and is really like there for me, and she's just such a good soul. Like, she's just one of the kindest people that you'll ever meet.
Okay, I probably don't need to say very much more other than that video, and I'm really glad you can't see me, because every time I watch it I cry. Homestart in Suffolk is a family support charity. We are a county-wide service with offices in Ipswich, Waveney and West Suffolk. And at the moment we have 240, in excess of 240 amazing volunteers offering face-to-face, phone and virtual support to families who presently have at least one child under the age of 12 living in their family. Our volunteers are trained and supported and supervised by our team of coordinators who work with the family, the volunteer and the agency that refers the family to achieve the outcomes that are identified at the referral with the family. Average support for a family is around 4 months, but this can be longer and shorter because each family that we work with has an individual package of support put together, and that we regularly, you know, work with the other agencies that are supporting the family and the family to review and address where we're going. Support is from 7:30 in the morning till 8:30 in the evening. And we welcome calls from anybody who would like to kind of make an inquiry about whether we can provide support to a family. And at the moment, we're able to introduce a volunteer to a family within 7 working days of receiving a referral. So we've got a really quick turnaround right now. Since COVID, we were able to respond very quickly to the needs of our families, and while we weren't able to deliver face-to-face support to our families, we transferred our support over to virtual and telephone support, which has been really well accepted, and we've continued to deliver support throughout lockdown. But we are now starting to risk assess some referrals that are coming through with a view to delivering some face-to-face support to families. We've had an amazing response to volunteering during lockdown as well, and we've trained 35 volunteers who are supporting families for us right now. That's it, thank you.
Okay, thanks very much, Alison. And there's some lovely comments on the sidebar of people that found that film really moving. Home Start in Suffolk is one of the new organisations that have literally just joined the referral form. Now, I don't think we've got anyone from Lofty Heights, have we? No. So if we move on to the Phoebe Center, which is another new organisation. So are you happy to say a few words?
Hiya, can you hear me?
Yes, yeah.
Hi, my name is Raluca. I'm the Wellbeing Advocate for Phoebe. We are based in Ipswich and we are a registered charity. We offer advice, advocacy, support and counselling services. We are led by and for Black, Asian, minority, ethnic and migrant women. And we offer support particularly to those fleeing domestic violence. We assist them in accessing safe temporary accommodation, in writing visa applications in their own name, safety planning, support groups, domestic violence counselling and casework. And we also offer free legal advice on family law matters. Sometimes we accompany them to medical appointments and court meetings if they need us, and we can interpret for them from a few languages. We deliver English classes and self-esteem workshops online and in schools for women and girls from the local community. Recently, we have started focusing more and investing more in outreach work, particularly for minority communities who cannot speak English, as we are aware that they are even more isolated during the pandemic. Because of the pandemic, we have moved many of our services online through video conferencing and through the phone, but we are still working. Sometimes from the office, socially distancing, and sometimes remotely, but we are keeping the services going. And I think, yeah, that's us in short.
Just to add, thank you, Raluca. Just to add that actually we're not a new service. We've been operating for 12 years now. This is our 13th year in Suffolk here in Ipswich. And so we are sort of really pushing ahead with the agenda to sort of encourage participation regarding sort of prevention of COVID, the spread of COVID at the moment, because of the language barriers. Women are not aware of, for example, those who have insecure immigration status. They're afraid to seek medical attention. They're afraid to seek help from mainstream organizations. And so we're really encouraging them to come forward and to seek help and to be safe. And we're offering them help, sort of explaining in their languages, what the government guidelines are, because that's quite important and quite key. So that's our focus at the moment, sort of encouraging participation in the process at this very difficult time, and we want to sort of prevent further deaths of the BAME, communities, because that's quite a challenge as we know at the moment. Thank you.
Thank you, Molin and Raluca, very much for that, and welcome to the warm handover and the partnership, and really good to have you on board. I think we've got time for Realise Futures. They've also got a short video, and then Leanne, if you want to say a few words. The video is quite quick and quite short, so pay full attention when it starts. Hopefully Eleanor will get it up for us. Yeah.
If you want to find out more, please contact us on 01473 275 957. You can email us at coaching@realisefutures.org or complete a referral form on our website, which is www.realisefutures.org/work-well-Suffolk.
My name's Eve.
Okay, thanks, Eleanor. So over to you, Leanne.
Hi, thanks. Again, like the rest of you, Realize Futures is a huge organisation that has quite a lot of projects going on. I'm representing the Coaching Service, which is a new service that started in April. So again, we were working remotely using video conferencing and telephone calls mainly, but we are now starting to see people again. So we can work with anybody who's unemployed over the age of 18, and we can specifically, well, we can give additional support to people who have learning disabilities, mental health difficulties, or long-term health conditions. So we can work with people to kind of help them really think about what they'd like to do, and we can work on health and well-being goals, as well as things where they'll kind of like improve their skills, maybe access some training or look at employment, and also just get people more connected and kind of involved in more groups in their community. Alongside that, we can then refer on to other things within Realize Futures. So we are doing a lot of tutoring again. So we're doing very small groups. So up to 6 people can meet with the social distancing measures in place. So we've got English and maths running again, ESOL. We've got health and wellbeing courses running, so confidence, building self-esteem, that kind of thing. We're doing courses on IT, building people's IT skills, and we're trying to help people get access to Wi-Fi as well, so helping them to look at budgeting so that they can maybe take some money from maybe like their TV package or something like that, so that they can then afford Wi-Fi, so that they can be more connected, because we've just realised there's just such a huge gap between the people who can join in things on, you know, if they've got technology and if they've got access to Wi-Fi, and those people who haven't got that at all or just got a smartphone, and that really limits what they can get involved in. So we're really trying to work to sort of help people to get access and to have technology and to learn how to use their smartphones or to use a tablet, that kind of thing, so they feel more confident to be able to do that, to be in touch with other people, but also to access training, groups, and activities and that kind of thing online. So yeah, that's a very brief overview. Hopefully that makes sense.
Okay, thanks very much, Leanne. Have we got Kath and Restitute on the call? No, because I know Kath said she'd be hopping in and out, so we'll come back to her. Right, I think we've just got time for Sue Ryder, and then we'll have a break for about 10 minutes. So I don't know if that's you, Judith, or whether we've got Alana, but over to Sue Ryder and Dementia Together.
Hello, yes, I'm Judith Goldsmith, and I'm the Dementia Together lead navigator. Dementia Together is a service that was commissioned in 2017. It was jointly funded by both Health and Social Care to provide support and information to people living with dementia families. The idea of the commissioning of the service was to ensure that it was a one-stop shop for people living with dementia and their families. So if they come to us, come to Dementia Together and tell us their story, then we can help them to access any services or support that they need. We work very closely with statutory health and social services, and also the voluntary sector. We have a helpline which is open from 9 AM until 6 PM Monday to Friday. We also the helpline is also open Saturdays, Sundays, and bank holidays from 10 a.m. to 4 p.m. During the it's Saturday, Sundays, and bank holidays from 10 a.m. to 4 p.m. We also have over the COVID, we have navigators who are out in the community. And up until prior to COVID, they were visiting people at home and carrying out holistic assessments, which we were sharing with permission with health and social care. Since COVID, we weren't initially able to do those home visits, but throughout the summer we were able to do garden visits. And recently we have started to do home visits again, with using the necessary PPE and social distancing. We also are using Zoom and interacting with people through social media as well. We have the helpline are making follow-up calls to people, and they have been doing from the very beginning of the pandemic. They've been ringing anyone who's registered with us just to check that they're okay, and if there's any help and support that they need, because we know with dementia that things can change very rapidly. We'll work with people from very early stages, whenever they're going through that initial diagnosis, right through to the later stages of dementia. So with our Zoom sessions that we have developed, as COVID has been during this situation that we're in, I'm actually running a Zoom session, a wellbeing session on the Wednesdays, for people living with dementia and their families. And it's for both the person living with dementia and their family carer are involved sort of in that session. So it's really about helping them to think about and look after their own well-being. The service covers the whole of Suffolk. Originally it was Waveney was excluded, but it's since in the last 2 years it's come through and is also part of the service. And we're currently commissioned until the end of March 2022. So we get a lot of referrals from health, social care, and also memory clinics. GPs refer directly to us, and we use the warm handover. It's absolutely been a fantastic tool for us. To be able to refer to a number of partner organisations, to be able to share with permission the story that people tell us, and help them to get the support that they need.
Thank you very much, Judith. That's great. Thank you. Right, we're going to take a sort of short break now, because I'm sure you'd like to sort of have a break from staring at the screen. When we come back, if Laura could say a few words about customer first, that would be great, and then we'll finish off the other organisations. So if we're able to come back at just after 10 past, so try and be back for 10 past 11 or just a couple of minutes after. If in the meantime you think of any questions and you want to post them in the chat, then that'd be really helpful. So see you in a few minutes. Thank you. Hello, welcome back everyone. If you can just unmute just to let me know if you're back.
I'm back. It's Janet.
Okay, thank you.
I'm back.
Back. Hi.
Still here, never left.
Right, great.
I'm here, Kath.
I'm here, Sharon.
I'm here, Imogen.
I'm here.
I'm here, Leanne.
Okay, great, thank you. Okay. I think we'll make a start for the second half then, if that's okay. So we've still got quite a lot of organisations to get through. I hope you found the first half useful and interesting. I know there's an awful lot to take in, but we can hopefully share the recording with you, and then you can sort of pick it up with colleagues and go back to bits that you may have missed. So if we've got Laura, Nikki and Nicole, all from ACS. I thought it'd be useful just to have a short sort of ACS bit. So Laura, are you with us from Customer First? Okay, how about Nicole?
Yep, I'm here.
Okay, great. So do you want to talk a little bit about the IWS and what that is? Okay, great, thank you.
Yeah, definitely. So I'm a social worker in a team called the Independence and Wellbeing Service, also referred to as the IWS. And we are a social work team within ACS, which was formed officially about three to 4 years ago. And we are made up of social workers, independence and wellbeing practitioners, and occupational therapists. And the team that I'm in covers Ipswich, Woodbridge, Felixstowe, South Rural, Stowmarket, Saxmundham, and and one of our team's main function is to provide assessment and support to what we refer to as new customers coming into adult community services. So these are individuals who have either never contacted social care before, or they're people that have made contact with social care, but they don't have an active care and support plan in place, so that they aren't currently receiving sort of a paid for service through Suffolk County Council, like a care package or something similar. So within ACS, so we have a 3-tier model of working, and how that links to our team, I'll explain. But tier 1 is to sort of provide individuals with the help to help themselves. So this is usually people who have the ability to make telephone calls and to seek support from other organisations, but need to know who to contact and how to contact them. So our role in that would be to provide them with the information they need, which is where sort of signposting to services like all of you comes in. And a tier 1 response may also be, us sort of encouraging someone to make contact with their GP if we identified there were health needs, requesting a medication review if we felt that was needed, and sort of referrals onto community health teams for sort of mobility, falls input, that kind of thing. Tier 2, which is short-term support with a focus on what we call reablement, and that's really trying to get people maybe back on their feet after a period of being unwell or a period of being in hospital, and really trying to sort of work with them to maintain a level of independence ongoing. So our role in that may be making a referral to our in-house care agency Home First for up to 6 weeks of care to really try and sort of build on that person's strengths and ability and get them living independently at home again. We can also access funding for sort of assistive technology. So, for example, this week I've supported someone with epilepsy to get an epilepsy watch, which helped them to understand when a seizure was coming on, and really they just needed that bit of technology to really get that level of independence back again and to feel reassured and sort of get back on with their lives as much as they could. So little sort of things like that can be really positive. And then we have tier 3, which is sort of our long-term support. But our team's role is really to promote and provide that tier 1 and tier 2 support to people to increase independent living and to reduce reliance on sort of long-term services, really. And all of our referrals comes through Customer First initially, and Customer First provides any relevant signposting advice that they can sort of at the front door there. But if there is a further need for sort of social work input or occupational therapy input, it would then be passed to our team, and we would provide a telephone assessment initially with the person. Do as much as we can over the telephone, obviously in light of COVID. But we are still providing home visits to people where we need to do a face-to-face assessment, and that may be where there are communication needs, where somebody's mental capacity may need assessing as part of the assessment, and also where there may be sort of safeguarding concerns where sort of an over the telephone conversation isn't appropriate. But that's kind of us summed up in a nutshell.
Okay, thanks very much, Nicole. And you mentioned customer first there.
Yeah.
And the main route into, well, the route into social care to make a referral in is through customer first. That's the sort of front door.
Yes. Yeah. Yeah.
But on the warm handover, all the social work teams can make referrals through to partner agencies. So that's why you might see a lot of the teams listed, but you can only refer in via customer first.
Yes.
I think we've also got Nikki Baggett on the as part of the meeting. Did you want to just say anything further, or are you happy with what Nicole's said?
Hi there. No, I'm perfectly happy with that. Yeah, I think that's clear enough. I'm from one of the neighbourhood teams, so I found it really interesting so far to listen in, and I'll be feeding back to the team members to make sure everyone's aware of all the great things that are going on in the community, because it is difficult for us to keep up track of everything, especially in light of the current changes. So it's been really useful to me. Thank you.
Yep. Okay. Right. Thank you very much, and thank you, Nicole. So we'll now move on to. I don't think we've got. Or we'll go back to. Have we still got Kath to restitute? If you could say a few words with us.
Yes, I'm here. Hello, everybody. I think some people have heard of Restitute, but for those that don't, we are a specialist service that supports third-party victims of crime. That's the mums, the dads, the parents, the carers, the grannies, the partners, siblings of people who have survived things like childhood sexual abuse, domestic violence or sexual violence. And we specifically support the carers because we believe that that the carers are a very hidden and forgotten group of people who are highly stigmatized and who really need as much information and support as they can to help them deal with the trauma, not only of this kind of disclosure, but also the trauma of caring for somebody who is likely to have very complex needs, and to deal with everything else that is going on in their life, which very often involves a huge amount of multi-agency involvement. We offer support through 3 different strands, if you like. The first one is a dedicated support worker who provides consistency, action planning, helps with organisation, and really works with the client to try and cut through some of that guilt and shame and stigmatisation which they feel hugely, which is incredibly paralysing and can leave people feeling totally isolated and alone. The second thing we have is a practical support budget, which we use to show our clients that they are valued by society and that what they do is really important and essential. Again, that cuts through the stigmatisation as well, and we use that budget to do things like deep cleans, doorbells, cat flaps, light bulbs, driving lessons, really something that is going to help the client feel better about themselves, more positive, more supported, and more valued. And that really does make a huge difference to their life. And the third thing that we offer is a counselling service specifically for those carers in those traumatic circumstances who are often really, really struggling with their own emotions, not only of dealing with what's happened to their loved one, but also dealing with some of the behaviours that they have to face. And increasingly, we're finding that, as an example, someone may have left a traumatic domestic violence situation, only to discover that once they've left, that the same perpetrator sexually abused their children as well. That's a really complex situation that they need some help. We're hoping to join the warm handover scheme. Happy to answer any questions.
Okay, thanks very much, Kath. And Kath's in the process of completing the paperwork to go on the warm handover, so hopefully fairly soon she'll be one of the partners that you can refer to. I don't think we've got anyone from Suffolk Community Health, have we? No. Okay, so just to sort of give you background on community health, they're the community health teams and the community hospitals, and on the referral form they work in the same way as Customer First and ACS, in that you can only refer to one central point, but all the various teams can make individual referrals. So you might get a referral, for example, from Felixstowe Hospital, but you can't refer directly to the hospital. You have to refer into a coordination centre, and they're only accepting referrals for someone at risk of falls. So it's really for referring in, it's a particularly older people who you feel may be at risk of having a fall, and they can pick that up and work with the person. So I'll now move on to David and Suffolk Family Carers.
Hello all. I've been involved with Suffolk Information Partnership for as long as I can remember, almost since it started, I think. So, I can only say how valuable it has been to me and the projects I've been involved with over the years. So I'm here today to, as Kate says, represent Suffolk Family Carers. I'm sure you've all heard of us, so I won't go through every single service that we provide. However, just to let you know that we, as a charity, have been going for 30 years plus. We employ 70 staff and around 60 volunteers as well, and hoping that number will raise this week with Volunteer Action Week. We work in the community to support family carers of all ages, that's 5+, and in a variety of situations, including schools, colleges, GP surgeries, hospitals, community-based services, and anywhere really where we'll identify family carers. Our funding comes from very different sources, including the CCG, Suffolk County Council, lottery, education, etc. I'll update you on some services that have that you might not know about, and some of them come through COVID. A lot of our staff teams are now working from home, and we are getting back into the community doing garden visits, and we have got the risk assessments in place to get our motorhome back out again to promote and to meet people, and all appropriate risk assessments have been in place. So telephone calls and video calls and things like this have been the norm for us since about March, but we are getting back out there, and staff are getting back to Claydon as and when they need to as well. So all projects are free and they're based across Suffolk. If you want to know more about them, please look at our website, and I'll put that link on the bottom at the end. Just a project you might not know about. So the first one is At My Bedside, which was a project that was set up in COVID. As you know, a lot of families, I know you might have had the experience yourself, found it difficult to support people and connect with people whilst they're in hospital. So we're working together with Ipswich and West Suffolk Hospital to provide, excuse me, the opportunity for people to connect with their loved ones within hospital, and we work with hospitals via the use of technology, telephones, video chat or email, to ensure that contact is still made, and that was so successful through COVID we decided to continue with that. Unfortunately, it's not available in a James Paget Hospital at the moment, but that's something that we'll be working on. The next project we'll talk about is Neurodevelopment Pathway. We are supporting parents and carers who have a child or a young person under the age of 25 that might be either just had a diagnosis or about awaiting a diagnosis of something like autism or Asperger's, and we offer them information and advice. We offer one-to-one sessions, and we can set up a personal support plan with that family as well. That's available again through our team here. The next project I wanted to talk about was the Military Families Project. That is a project which is set up to support anybody that's in the British armed services or reservists, and the people that we support in that can be single, unoccupied, unaccompanied soldiers living locally that's supporting somebody afar. We support family members. We support couples, couples with children, families living in Suffolk where the person they're supporting is living outside Suffolk, and also we support families when their loved one is out on detachment as well. So that's another project. And we've just, as the organisation, we provide social prescribing support as well. I know there's other organisations on board that we work alongside, and we've just set up a new project in the east of Suffolk. That's a 3-year project. That's Social Prescribing Plus under the name of Connected Communities. That is a project not just here but also in Kent and over in France as well, and that is supporting people who currently aren't in social prescribing support, 65 plus. They have access to all the different services in this area. We build a circle of support around them to do that, and we're really pleased that we can work alongside Access and Shorter to provide that service. Also our colleagues at East Suffolk Gov and Suffolk County Council for that. Just a little bit about how we've coped with COVID. I said a lot of our services have gone online. We have developed a lot of our courses for family carers to deliver via Microsoft Teams, and we've set up our meeting room at Claydon, so some people can attend in small numbers, but also we've got a big video screen where people can still join the session if they can't leave home. It's an organisation we've seen, we've met the challenges like most of you around the table and have to be innovative and ensure that we still support family carers. There's still places we can't get into, hospitals and GP surgeries, obviously still a place we can't get into, but as I said, like the project earlier around By My Bedside, we're continue to support that way. We have a team of advisors that work Monday to Friday and a late night on a Tuesday till 7 o'clock, and we have a live web chat which is open 7 days a week as well. So that was a whistle-stop tour of Suffolk Family Carers. All the information is on the website. I'd be here for another hour if I explained every single service, but any questions?
Okay, well, thanks very much, David. That's really helpful. And unfortunately, we are getting a bit tight on time, so I'm going to and I want to make sure everyone has a chance to say something, so I'm going to hurry along now. So if you can try and stick to your 2 minutes, that would be really great. So
sorry,
the next,
I didn't do that.
no, I'm not having a dig at you, David, because it's really interesting, and I think it's important that everyone, you can share all you're doing. But if we can move on to Julie from the fire service, please.
Hi, yeah. I just want to say I'm feeling quite optimistic about the warm handovers. It's good to bring everyone together, so many organisations, because I've always felt it worked really well. So glad to see it moving forward. So Julie Richard, Community Manager for the prevention team within Suffolk Fire and Rescue Service. We're not just about putting out fires and attending road traffic collisions. Prevention is becoming a much more important part of the fire service. So we deliver home fire safety checks. These are aimed at vulnerable people. Our highest risk of fire are people over 65. We have concerns regarding people who are bedbound and housebound. People with mobility issues, those living alone, particularly men over 65 are a very high risk, smokers, people with all sorts of disabilities, including hearing impairment where they may not hear a smoke alarm activate, single parents, and currently hoarding is top of the list, and that's on the increase. So you can understand why that's a big concern for us. It appears that people are living in very chaotic situations these days within their homes, and I think it's getting worse. So we rely on other organisations to highlight the risks that they may be aware of or have witnessed. Our visits consist of a walk around the property to identify risks, overloaded sockets, cooking risks, heating issues. The visit takes about an hour. We carry equipment, so we fit and test alarms, smoke alarms. So we may replace alarms, we may put smoke alarms in where there are none. We may replace faulty alarms. and we may add in additional alarms. What often happens is people have lost the ability to access the upper floor of their homes and now sleep in a downstairs room. So we may be putting a smoke alarm directly in that room, because that's obviously a higher risk. We fit heat alarms in kitchens now, so they're less sensitive than smoke alarms. They will identify an increase in high temperature and flames, the appearance of flames in a kitchen area. Sensory alarms are provided for people with hearing impairment, so that's based upon a vibrating pad under the mattress and a strobe light unit by the bed, so that when people are asleep without their hearing aids, they can actually be alerted to the fact there is a fire in their property. And in the last couple of years, we've been providing retardant bedding. There's a lot of people out there who smoke in bed, so we are providing that, and throws for people who are sitting in chairs during the day, maybe, who are smoking. It won't remove the risk, but it will considerably reduce the risk. Visits are delivered by our whole-time firefighters, but we have a team of specialist prevention practitioners who work at a slightly higher level. So anything that comes in that is extremely complex, then we will send a prevention practitioner along. We also have a team of volunteers who support us with delivery of our home visits. The practitioners deliver a safe and well visit, so that includes all the above plus any observations regarding whether people are safe and warm in their homes, any trips and falls evidence, smoking cessation where we can encourage that, and social isolation. We also continue to work with trading standards to deliver information regarding scams and doorstep safety. We've been working through the pandemic. We prioritised high-risk properties. We found creative ways of providing equipment, even if we weren't able to enter properties, with a lot of help from carers and family members. There sometimes is a delay in our visit. We are a small prevention team, and if the person lives within close proximity to a whole-time or a day crewed fire station, then a fire crew will visit them. But for the more rural locations, that would be our prevention practitioners, who of which we have 4 currently. So there is quite a lot of work there. If anyone was referring to us and they have particular concerns, then flag that up, because we will prioritise where that's been identified. So we get a lot of referrals from social workers, care providers, housing officers, and associations, and directly from the public. There is a route in directly through a telephone line and a page within the Suffolk County Council website. So all I can just say finally is anyone that might be visiting homes, on our behalf, if you could test smoke alarms, which is literally, if the ceilings are a little high, you can grab something to reach up and just test smoke alarms, because knowing that people have got smoke alarms in their property isn't enough. Knowing that they're working is important. So anyone that does home visits or will resume home visits at some point, if you test alarms and you find they're not working, then make a referral to us and we'll go in and replace the alarms. The service is free, and that's it.
Okay, thanks very much, Julie, and that's a really important thing to highlight, so thank you. Swiftly moving on, I think we've got Kelly from libraries, and I'm not sure if we've got Sarah as well, but again, if you could be fairly brief, I'd appreciate it. Thank you.
Hi, Kate. Yeah, that's fine, no problem. Of course I can. Hi everyone, it's lovely to have us all back together again. So yes, I am the information for living librarian, so my role covers health information and information around universal credit and employment, as well as a number of other things. When COVID sort of struck, we basically got as much online as possible, so we spent a lot of time and energy looking into getting our platforms up and running. So we have a really full and free e-library service now, so the all the information that you might like to get in terms of like reading, audio and ebooks, also free music, Freegal. There's a Canopy, we fairly recently launched that last year, which is a free streaming service, which is around courses, and you get credits to do free courses and also stream arty films, which is nice. And Press Reader, which is free magazines, and also newspapers. So I just thought I'd give that a quick plug because it's quite handy if you're at home and you want to access this. You just need your library card and number to log on. Now in terms of where we are in the reopening of all the libraries, we've got all the libraries open except for Saxmundham, West Suffolk House and Rushmere Local. So we're doing okay. We've got some PC usage and now browsing for people. There's also a select and collect service, which if people prefer to go online and reserve some books and then just collect them at their local library, then that's also available in terms of services. So yeah, we're obviously taking all the concerns of people with COVID really it's really seriously, and face coverings obviously mandatory now in libraries. But just to say that it is, we are open, so please do come and see us, as well as visit our library, online at www.suffolklibraries.co.uk, and you can find out pretty much anything that's going on locally, and all the activities that we couldn't do in-house are now on our YouTube channel, so we've got that up and running too. So baby and tot activities, and arts and crafts, and a number of other great information services have all gone, so we've really done everyone's pulled together and done a great job in terms of getting behind the new ways of working. So what else to mention just quickly? The perinatal, me, myself on baby. Also, it was a dodgy time for it to launch, but bless Ruth, I know she's working with Suffolk Mind on the project, so they're doing email and Zoom support for mums at this time as well. There's an awful lot going on, but including if anyone's interested in their family history research, Find My Past have kindly given us a remote offer, so we can also give out the login for that if people are interested in doing some genealogy. And yeah, and it's a good time to obviously have have some family research time. So yeah, things are going well. It's obviously really challenging, but yeah, we're getting there. So but if anyone wants any information, obviously please do let me know, or have a look online, and we're very happy to help. So hopefully I've quickly done that in time.
Okay, thanks Kelly, that's great, thank you.
No problem.
Have you got anyone from Survivors in Transition? No. Okay, so we'll move on to Leslie then at Trading Standards.
Hello, morning everybody. I'm Leslie Crompton. I work for Suffolk Trading Standards. We're part of Suffolk County Council. We are a legal authority. We support consumers, but also we support businesses. This includes an inspection regime for legal compliance. We inspect offences, investigate offences, and we prosecute offenders. We also have a very, very strong remit regarding our fair trading work. I'll just give you a quick rundown of the stuff that we have within our legal remit. Age restricted sales, illicit tobacco, weights and measures, so that's your pubs and your petroleum sites. Fair trading, doorstep incidents, scams and fraud. Explosives, fireworks, we've got a busy period coming up because we have to inspect everywhere in Suffolk that stores fireworks. Product safety, including imports into Felixstowe docks. Food standards, that's labelling, composition. If you go to a pub and you order French veal, that you should be getting French veal and not some just cheap pass-off meat. Intellectual property goods, animal feed, crops and composition, and animal health and welfare, that's movement and identification of the animals, and disease control. For example, we control the legislation regarding the spread of rabies. So if we get an illegal import of a puppy or a kitten, we have to go out and undertake that work. Regarding our fair trading work, and this is key, I think, for the Suffolk Information Partnership, we support Suffolk consumers when they become victims of scams or fraud. Doorstep fraud is quite common. the chap's knocking on the door saying you need your bush trimming, madam, or else the council will sue you. We can do it for 30 quid. So the chaps come along and start doing the work, and then all of a sudden it's gone up to £300 and then 3,000, and then they're trying to take the little old lady to the bank in a minibus. We operate a rapid response system to that incident. We can go out, take control of the contract and prosecute the offenders if necessary. We work with police, social care and the court system. We actively prosecute rogue traders. We do have a very vivid Facebook and Twitter feed where we talk about those prosecutions that have made a difference to people's lives and supported our consumers. And we support victims of scams. Financial abuse, it's fraud, it's a criminal offence. We reassure those victims, we give them advice and support. We quite often intercede with the banks for them and with friends and relatives trying to support them. We also remove scam mail and scam products to reduce the amount of victimisation and bad feeling that those individuals have. And also, as Julie referred to earlier, it reduces and prevents hoarding. We also set up no cold calling zones, anything to deter rogues from taking advantage of Suffolk citizens. We have used the SIP in the past and will be doing so in the future. And we would encourage people to come and talk to trading standards. We can support your organisations by offering you training of your staff, and we can also talk to your clients for you and give them that reassurance. If they've been a scam victim, it's not because they're stupid or foolish, it's because they've been victimised, they've been groomed, and we're here to support them as a local authority. Thank you.
Okay, great. Thanks very much, Leslie. Thank you. And sorry you're down at the bottom of the list, Imogen, but voiceability.
Yeah. Hello. Yeah, so I'm the at Total Voice Suffolk. We're a partnership working to deliver advocacy in Suffolk. We have the contract with Suffolk County Council, so we work alongside Suffolk Family Carers, Anglia, Impact, Suffolk User Forum and the Royal Association for Deaf People. And we are the lead partner in that, so I work for Voiceability. And the statutory advocacy we provide is independent mental health advocacy for people detained under the Mental Health Act, independent mental capacity advocacy for people who lack the capacity to make decisions about their long-term accommodation or serious and have no family or friends appropriate to be consulted in that process. We have the RPR service, largely delivered by Suffolk Family Carers, which is that's the relevant person's representative. So for people who are under a deprivation of liberty safeguard, so we support people who have nobody else in their family or a friend to support them with that. We also do deliver the Care Act advocacy, so supporting people to understand their rights and to be fully involved in any decisions about their care and support if they have substantial difficulty. So there's eligibility criteria applies to all this particular one. So it's about local authority assessments, care reviews, care and support planning and safeguarding process. We support children and young people in certain situations. We have the NHS complaints advocacy service, which is actually open to anybody. You don't need to have a care or support need to access that. And finally, last but not least, what we call general or professional advocacy, where we support people with care and support needs who are facing all sorts of important decisions. So it could be something that involves a local authority, could be health or care services or another service provider. And it could be, for example, making a complaint when it's complex. Big part of our work is with parents with learning disabilities who are involved in child protection proceedings, and generally people who lack the capacity to understand the information. And our role is to ensure that their voices are heard in those processes. Hope that was quick enough.
Okay, thanks so much, Imogen. I really appreciate that.
Our website on the chat.
Okay, brilliant, thank you. And sorry you've had to wait till the end. We've also Sharon Lee from the Suffolk Wellbeing Service has put some bit about her service down on the chat bar because unfortunately she's had to go. Right, we are a little bit behind time, and the other thing I wanted to do this morning was just run through, particularly for the new partners, but also as a refresher about the warm handover and how to complete the form and any sort of hints and tips. So I'm going to share my presentation with you, which hopefully you can see. Okay, so Eleanor, are you able to see that?
Sorry, yes, that's
Yeah,
coming
okay,
up
so that's
fine.
coming
Yeah.
up. Okay, great. Okay, so I'm going to whiz through this fairly quickly, but if anyone's got any questions, we can pick them up sort of at the end. The actual web link for the referral form itself does need to be kept secure because it's not for the general public, it is just for partners to use. So please make sure that you don't give it out to any members of the public or have it on any literature that the public can have access to. Right, I'm just trying to move on to the next slide, which, oh, there we are. Okay, so this is the referral form itself, and you'll notice at the top that it does say it will time out in 45 minutes. So it's fine if you're working on the form, but if you go off and have a conversation with someone or make a cup of tea and you leave it for a while, it will time out. So you do need to complete it in one sort of go. And you'll also see from the sections, it's in different sections. So the first part where you put your information in, and then there's also details for person with care needs and details of family carer. And when this form was designed, the warm handover was mainly for organisations providing care and support. So it has got quite a health and care focus. And this is something that we might want to look at in the future if sections or questions aren't appropriate or we need to add questions, we can do that as we start using the form. But it also means that you can actually refer two people on the same form. So if you've got a couple, husband and wife, and one of them presents with one set of issues and someone with another, you can refer both through on the same referral form. So we'll go through each of the sections very quickly on here. So the first section, as I say, you put your information in, so it's you as the referrer. At the bottom, you'll see here you've got an option to choose whether it's just for what we're calling the person with care needs. So that's basically the primary person needing support, or whether it's for the carer or whether it's for both. So it's important that you select the right one there, because then you'll get the rest of the form displaying correctly. Or if you just select person with care needs, you won't get the carer information, so it'll be quicker for you. One bit to note is organisation name. So here I've selected ACS Customer First, but you can't actually type into that box. You need to go to the magnifying glass, the lookup symbol, and then a pop-up box will appear. And the easiest thing to do is just type into the search box. And if you use an asterisk at the beginning, it will do like a free text search. So if you put in something like Felixstowe, it will pick up the library, the Citizens Advice, the social work team, and Felixstowe Hospital. So it's quite quick using that search there, because as you can see, there's quite a lot of different teams and organisations listed. So here I've selected Customer First, and then you just select it into the box. At the bottom of that page, you have the option, who are you making this referral for, and are you making it for the person who contacted you? So it could be that if a daughter has referred mum and dad, the referral is actually for mum and dad, but and not for the daughter, so which means that you wouldn't have any contact details for the daughter. So this is a way of capturing any details of a person that's contacting you that may not actually be receiving any support. Most people that do come through, you'll have had direct contact with, so it's unlikely you'll use this, but it's quite useful to collect that extra data if that's relevant. So we filled out your details, and you can see that that section's now ticked, so that's complete. You've always got the option to go back to a previous page if you want to change anything. So this is now details of the person with care needs. So there's two sections to this. The first page is contact details, so name, address, phone number, etc. Now the second page, you might think, well, why is it asking all this information? So here you've got date of birth, you've got a unique reference number, you've got GP details. Again, bear in mind that this was set up for health and care support. So if that isn't relevant, you don't need to complete it. So none of these sections have got a red asterisk against them, so they're not a required field. So if it's not appropriate, you don't need to complete it. But something like date of birth may be, if you've got certain criteria around services that you offer. At the bottom of that page, it also asks you about method of contact. And so that's quite helpful. So if you've got some hearing or how they want to be contacted, whether it's a landline or a mobile, and you can also put in here what is the best time of day to contact them. So it may be someone with mental health issues who struggles to get up in the morning or got chronic fatigue. So the best time to contact them is in the afternoon. So you've got the option to put that into the form. And then if there's any particular support or anything that you want to make the receiver aware of, you can then tick any of the communication boxes below. Okay, so that's completed the details for the person you're referring. And then the next section is about the referral. So this is the first box here is mandatory. You do have to complete that, but the other two you don't. But it's useful if you do have information to put in there. And if you're referring to more than one organisation at a time, which you can do, then obviously it's useful for all those organisations you're referring to see the information, any extra information like any other support that you're giving the person. So in the purpose of referral, this is where you're setting out the circumstances that you're referring someone for, and generally the sort of support that you think they might need. So you're not putting specific support here for organisations. This is just the main reason why you're referring the person. And please be as concise in here as possible, but put enough detail so that people can get a good picture of that person. Because part of the reason for using the warm handover is that people don't have to tell their story again. So the referral should give you enough information to form a good of the person being referred, and you can then start asking them questions based on knowledge and fact that you've got from the referral form. So I haven't selected the carer, so it's bypassed the carer information. So it's gone straight to, now who do you want to refer to? And see here that you have to add an organisation. So this is where today has been really helpful, where you've got a good idea of all the different services. So you've already had that conversation with the person about why you're referring them and the sort of support that they should be able to get. So this, the next page on here, you click on the add an organisation, and this is where you're actually choosing who the referral goes to. So you have to select that it's person with care needs, because if you're referring to people, then it needs to be clear to the organisation that's receiving it who this support is for. And then it's the same lookup using the little symbol to actually select the organisation. And then you have to put in a purpose of referral. So why are you specifically referring to that organisation? And then hit submit. And you can see in this example, I've chosen Suffolk Mind, but you can see behind the pop-up box, I've also referred to Citizens Advice as well in Ipswich. So this is what it looks like when you've completed the organisations you want to refer to, and you do have the option to edit. So if you want to add more information or delete an organisation or add another one, you can do that. And then once you've completed that, you've completed the form, it then comes up with a review. So you can go through and check that you've got all the details correctly, telephone numbers, contact details, and change anything that isn't quite right, particularly checking spellings of names and that sort of information. And then at the bottom, you can see who you've referred to, and this is where you actually submit the form. So that will then go off straight to those organisations. There's no sort of human intervention in between. It's you completing the form, hitting that submit, and it goes electronically by email through to the organisation that you've referred to. And all emails go encrypted, so it's all data secure. And these referrals sit on the County Council sort of platform, IT platform, which is all safe and secure. So that's a very quick whistle-stop tour of how to complete the referral form. And just a tip that the more meaningful and useful the information and concise the information is in there, the better it is for the organisation receiving it. And also being aware of what organisations do and their services and whether it's an appropriate referral is really key to being able to make a good referral. Just very quickly, just to finish off with some resources to help you. There is a Suffolk Information Partnership website. If you go to the partners page on that, you can see a list of organisations that are part of the warm handover with a brief description, and there's also a link through to their website. So you can use that along with today's meeting just to refresh yourself on the organisations. There's also a what partners do. So that's a bit more detailed about the different services. And in this example, I've chosen the consumer and debt advice. If you click on the button there, it then takes you into Infolink. So it links up with Infolink, where we've got specific SIP records, information partnership records for each of the organisations that are appropriate to that topic. And then by clicking on trading standards in this example, you can see the list of the services that they operate and also what they don't do as well, which is useful. Also on the SIP website, we've got a warm handover section and there's a help for staff. So there's some general information about what warm handovers are. And then at the bottom of that page, there's again that link to what partners do. And then there's some guidance notes and some hints and tips. And for all the new partners that have joined recently, you will have been emailed those documents. So they've got more details around, particularly the hints and tips around using the referral form. But you can also find a link on the website here. Okay, so I'm afraid that's a very quick whistle-stop tour of that. If I can just get myself back to. So just to finish off, and I know we're almost out of time. If I've unshared, I think I've unshared now. Yeah, we've just got some very quick questions. I'm just reading it. Okay, just to ask you, and we were hoping to do this on the whiteboard, but I don't think it's going to work very well. So what we're going to do is Eleanor's going to post a question into the question box around what you thought about today and also going forward. And if you can use, if you've got access to the emojis that pop up over the messages, if you can put hopefully smiley faces, but grumpy faces as well. So hopefully this is going to work. So Eleanor, if the first question is, did you find today's session useful?
Oh, sorry, my Teams is not responding. There we go. Oh.
Okay, we've got that twice now. So
sorry. So if you hover over it, and then that's it, somebody's put a little reaction there. That's great. Thank you, Imogen.
Okay, and then the next question is, how was the technology for you? All right, I know chat's going a bit mad at the moment, so hopefully you can get access to responding to that. So Ellen has just put that question up. Okay, the next question is, when would you like the next meeting? In December, or there's a follow-up question January? Okay, so Ellen has just put up the December and the January question. And then what would you like to see on the agenda? So what would you like that meeting to look like? And the very last question is, what other ideas have you got to keep in touch with everyone? Okay, so what would you like on the agenda for the next meeting, and any other ideas you've got, particularly to keep in touch? Okay, thanks very much for your comments. Do keep adding those. We were hoping to put them on a whiteboard so you could do it that way as well, but perhaps we will we'll investigate that for next time. Thank you all very much indeed for joining, and particularly for contributing. I think it's made it a much more engaging session, so really appreciate everyone giving their